Well, the new health insurance exchanges are supposed to open next week, allowing consumers, we are told, to shop for coverage. President Obama says all that competition is going to make health insurance affordable. What you don't hear him talk about much is the big reason insurance costs are dropping in some places. The New York Times points it out on today's front page. Many insurers are significantly limiting the choices of doctors and hospitals available to consumers. Jamie Weinstein is a senior editor at the Daily Caller. So that's one way to drive costs down. And according to the Times, Jamie, that's what's happening. Some of these insurers are saying, okay, you want insurance? You're going to have a very narrow selection of doctors and hospitals who can treat you if you get sick.
Absolutely. They're limiting access to doctors and hospitals, but it fits a common pattern that we've seen since this bill has been enacted. When President Obama was selling this bill, he made all sorts of promises that have turned out not to be exactly true. For instance, he said, we will insure tens of millions of more people, and plausibly it would not add to our debt. We know that was budget gimmickry now. He said that it will cost less. Maybe for some people it will, but for young people the premiums will actually go up. And now we know he said that you could keep your doctor. In some cases, if you're moved to the Obamacare exchanges, with this New York Times report, you may not be able to keep your doctor because of smaller networks. It just fits a common pattern of a bill of goods that was sold to the American people when this law was passed that just does not turn out to be true in practice.
Let's talk about New Hampshire and one of the state's biggest insurers there, Anthem Blue Cross and Blue Shield. There are apparently 26 hospitals in New Hampshire. Anthem says we're going to eliminate 10 of them as options under the new health care law. So, if all of a sudden more than a third of your hospital choices are out of bounds to you in New Hampshire, well, that's going to make longer drives and some other problems for people who get sick.
Right. According to one of the people quoted in the article, it could take at least a half hour to an hour for some people on this insurance to get to a hospital that's provided. That's not exactly great access to health care if you get this insurance. So that certainly will create problems for those who don't live near any of the provider hospitals.
So in the meantime, the House, as you know, has voted to defund Obamacare. Where does it go from here? I mean, is there really the appetite in the Senate to make that happen?
Well, I actually don't believe there's really a possibility to defund Obamacare. You would have to have the president, vote away or sign away his signature domestic achievement. And that first, you would have to get the Senate, which is controlled by Democrats, to vote to defund Obamacare. So I really don't think that's an option. I do think that there's a possibility that Obamacare could collapse under its own weight for reasons like this, but also depending on young people and healthy people to pay for insurance that they think they don't need, to spend money. They need them to sign up. And it's not clear that they're actually going to do that. So we're going to have to wait and see whether the Obamacare will actually get those young people it needs to support the exchanges to sign up. I think that's really where the focus is going to be.
The president said you can keep your doctor if you like your doctor. That doesn't seem to be holding up to scrutiny. We'll see. Jamie, thanks.
Thank you.